Good afternoon. I'm Dr. Traymore Murdoch. I'm an adjunct professor in the Department of Natural Science at Coppin State University. Welcome to the Health and Wellness Amidst COVID-19, our panel discussion. And thank you for joining us this afternoon. What I'd like to do is to introduce you to our panel members. We have Ms. Erica Jones, Dr. Jennifer Pope, Dr. Ashley Queen, and Dr. Ms. Latoya White. Just to give you a little brief bio on them, Ms. Erica Jones, she earned her Bachelor of Science degree in nursing from the Helene Full School of Nursing at Coppin State University. While at Coppin, she became a proud member of the Gamma Phi chapter of Sigma Gamma Rho Sorority Incorporated. She also is a registered nurse. She's also certified in infectious control and epidemiology. She's the current president for the Greater Baltimore chapter of APIC, which stands for the Association for Practitioners in Infection Control. Prior to serving as president, she served the board as chapter secretary and as president-elect education chair. Ms. Jones' accomplishments include published articles, national recognition for her teamwork approach to improve hospital cleaning and disinfection, and creation of various partnerships with schools and community organizations. She has spent the past several years creating education videos about the principles of infection prevention in healthcare. In 2018, she and her colleagues won the APIC International Film Festival Award for a video raising awareness about the risk of healthcare associated with infections related to construction and renovation activities. Erica is dedicated to patient safety, and firmly believes in APIC's mission to create a safer world through the prevention of infection. Our next speaker, Dr. Jennifer Pope. She's a retired nurse officer. Dr. Pope served in two branches of the uniformed services, the U.S. Public Health Service and U.S. Army, both as an enlisted member and an officer. After retirement, Jennifer accepted an assistant professor position in the Master of Science in Nursing, Family Nurse Practitioner Program with the College of Health Professions at Helene Fund School of Nursing at Coppin State University. Dr. Pope is a three-time graduate of Coppin State University. She earned a Bachelor of Science in Nursing, a Master's in Science of Nursing, Family Nurse Practitioner, and was one of the first graduates in the Doctor of Nursing Practice program. Her research interest involves increasing awareness about domestic violence and resources in the African American community. Jennifer presented her research in faith-based communities and conferences, even serving as a panelist. Dr. Pope is an active member of the Women's Veterans Interactive Capital Collaborative Chapter, where she serves as chapter secretary. Jennifer also serves as secretary for the Coppin State University Faculty Senate. In her spare time, Jennifer enjoys running, exercising, and gardening. To date, she's completed 4 full marathons, over 12 half marathons, and numerous 10Ks and 5Ks. You go. Dr. Pope is married to Brian Pope Sr. They have 3 adult children. We also pleased to have Dr. Ashley Queen to join us today, who happened to be a student of mine. Dr. Ashley Queen is a woman ready to inspire and change the world around her. Born and raised in Maryland, she has the exposure of the unique social, political, and professional landscape of living near the nation's capital. She has a Bachelor of Science in Biology with a minor in chemistry from Coppin State University. She further earned a Doctor of Philosophy in Microbiology from Howard University. Dr. Queen has worked in the government, nonprofit, and academia landscapes. She's a public health and regulatory professional with experience in managing programs in topical anesthetics, biological drug application, pathogen surveillance, health disparities, and in genome-wide association studies. Dr. Queen is a mentor and advocate for budding and early career scientists, always eager to support the next generation of STEM leaders. And we have Ms. Latoya White. Latoya White is a certified physician assistant that specializes in treating psychiatric disorders in people of diverse backgrounds. Ms. White received her Bachelor of Science in Biology from Coppin State University and a Master of Science in Physician Assistant Studies from Towson University. Latoya started her healthcare career 18 years ago as a combat medic in the United States Army, treating soldiers and their families. Latoya has worked on geriatric and child inpatient psychiatric units. She currently works as a psychiatrist physician assistant in an outpatient mental health clinic with offices in Baltimore City, Baltimore County, and Harford County. She believes that focusing our mental health is an important part of treating our overall wellness. So we want to thank each of you for joining us today. What I'm going to do is I'm going to ask some questions, and I'm going to start with Ms. Jones. In addition to frequent hand washing, wearing a mask, maintaining social distance, are there any other ways we can protect ourselves from COVID, the flu, or other infections?
Thank you for your introduction. And yes, there are definitely things that we can do to protect ourselves at all times. One of the things that I teach here at the hospital where I work is not touching your T-zone. Most people identify that with skincare, but in healthcare, the T-zone is our eyes, our nose, and our mouth. So we're always around germs, and we always want to make sure that we are minimizing touching our eyes, our nose, and our mouth. We can prevent a lot of infections by doing that. The flu, pink eye, all sorts of infections. So in addition to cleaning our hands, we also want to make sure that we're not touching our face. And then also there are a lot of frequently touched surfaces that we touch every day. There may be items that we share with other people, such as a mouse or a telephone or doorknob, things like that. So we want to make sure that we're cleaning and disinfecting those both at home and also in like shared settings, like if we're in an office or if we're in a dormitory or if in any public setting, you want to make sure that you're cleaning and disinfecting surfaces. And usually a good household cleaner is great, but if not, you can use like a bleach solution. And then also we just want to avoid crowds as much as possible right now. So with things kind of picking up this year, people are starting to do more in the community. I think a lot of people are starting to let their guard down as things are starting to reopen, and they're equating that with that it's actually safe to go out and be around crowds of people. So we want to minimize our exposure to other people.
Okay, what about you, Dr. Pohl?
Oh, hi. Thank you for the introduction. So what I would want to touch on is talk about the immunizations as a preventative measure during this time. We know we're coming into flu season. So the influenza vaccine is recommended. It's an annual vaccine, as well as a pneumococcal vaccine. That's usually given it's a routine part of the immunization for children up until age 2, but it's also given to individuals who are 65 and older, and also those who have chronic illnesses or smokers, people who smoke cigarettes between 19 and 64 years old. So that group can also benefit. One thing I wanted to touch on, additional thing, I know there are people who take public transportation. So it's very hard for them to avoid to maintain their 6 feet social distancing. So definitely they need to wear their masks. If possible, they can ask the driver, whether it's on a bus or an Uber or Lyft, to open the window to promote circulation. That can also help. Sometimes there are barriers in some of the Uber car. They've gotten creative, the glass barrier to prevent the spread. So that's what I'd like to add.
Okay. And you, Dr. Queen.
I would just say further to just ensure that when you're out in your daily activity, just be mindful of your behaviors. Kind of what was said earlier in terms of like touching the telephone and things like that. You don't want to just be mindful of your own behaviors. You want to think forward to the idea that somebody else may have just touched that object. And if they did, you know, what would you do to prevent letting something spread to yourself? That includes holding the door, pushing elevator buttons, going to the bathroom, or opening the stall doors. Like, I'm the type of person that I'll grab a paper towel and like open everything. But you know, things like that help to prevent the spread. That's all.
Okay, and Ms. White.
Yes, I would just like to say, you know, piggyback on some of the things we already said earlier about covering your cough, hand sanitizer, wearing your mask. What I do, what I tell other people to do is clean your hands before you remove your mask. That way you're not getting the mask dirty. I see people who have their masks, you know, in a car, they reuse them frequently. Wash your mask. One wear, one use, wash your mask.
Okay, another question. What's the best way to protect our families, including seniors and children? And I'll start with Ms. White.
So one way to protect our family, especially seniors and children, is for us to get tested. If you feel sick, if you feel feverish, not if you have a fever, but if you even feel feverish, you want to get tested. They're drive-through sites. They're very easy. Some are free if you're uninsured. You want to make sure you are using a good hand sanitizer. The CDC and FDA has a list of ones that are not safe, ones that do not have the appropriate amount of alcohol in them. And you also just want to be mindful of how often you're around people, you know, going out, could you get things delivered if need be, especially around the seniors and immunocompromised people. We want to make sure we're not bringing germs back to them in efforts in trying to help them.
Okay. And Dr. Queen.
My thoughts on that is from a scientific perspective. A lot of people who are on this panel today have a very diverse science background, and others who are watching it. And so when we learn these different things about the coronavirus or other infections, you have to recognize that depending on your family members, what their background is, what their age is, they may not have an understanding of what's being said on the news and like some of these more sophisticated sites like the FDA or the CDC. So something that we're trained to do normally is to be able to communicate science to all different types of people in the population. And you should practice that for your family, to think about ways that you can explain to your children why coronavirus is dangerous and why they should be careful in their interactions. For the elderly, explain to them that some behaviors that they've always done that they may be used to doing may not necessarily be the best idea for them to do during this time. And that could be a big step in protecting your family, especially if you have a family that loves to hug and kiss a lot. It's good to have that discussion.
And Ms. Jones, anything you would like to add?
So I work in a children's hospital, and I think we tend to let our guard down when it comes to children. We want to hug them, we want to kiss them. I've seen people literally kind of line up the children and want to give them all high fives down the row. And again, you know, we base everything that we do on science, and science is that if I touch every single child, then I could potentially expose each of them, or I could expose myself. So we want to make sure that we are telling people that, yes, we love hugs and kisses, but right now they're dangerous. And so we need to come up with some other ideas on how we can greet each other, especially children and those that are in the older population right now. So we want to make sure like the children are engaged and we're playing with them and doing things, but we have to be creative in some of the things that we're coming up with so that we don't put anybody at risk, especially those vulnerable populations.
Okay, and Ms. White, would you like to add anything?
No, I think they pretty much have it, especially when it comes to the children. I know in my family, we do hug and kiss a lot. But my mom created this thing where we do like virtual hugs, and you kind of just hug your, so you're still giving that love and affection, but you're being a safe distance.
Okay, all right, thank you. Next question. This is important for me. What are the best sanitizing agents for washing hands, bathing, cleaning surfaces in our homes, cars, and offices? I mean, I've heard a lot of things, but I need good advice. Not gargling with bleach or something like that. Let me start with then Ms. White.
So, like I said, there are plenty out there, of course, on CDC, FDA website. A lot of them make sure they have the 70% alcohol solution you're looking for. There were plenty of hand sanitizers floating around online that were not equipped to handle this virus or any virus for that matter. A lot of good sanitizers, the bleach solution is the best, the cheapest, the easiest to make in your home. One part bleach, 9 parts water. It's easy. You get a nice glass spray bottle and you can wipe down the surfaces. To disinfect, you may want to leave it there for a few minutes and then wipe it down. You have Lysol solutions. They even have concentrated Lysol. I know people can't find Lysol. They have the concentrated one that you can also make, that you can also dilute and have in your home. So that's good as well. Of course, the Lysol wipes and things of that nature, but remember, again, you can also make your own. You can get paper towels, put in one of those old bottles that you had for wipes and recycle it. So you don't have to keep purchasing things, standing in line, fighting with people to get wipes or sanitizer.
And what about from you, Dr. Queen?
So I would say the best sanitizing agent that you should use is soap and water. That's the #1 strategy to go for. When it comes to hand sanitizers and agents like that, you want to stick with some of the major ingredients that are approved by the FDA for over-the-counter use. And those include alcohol, such as ethanol alcohol or isopropanol. There's other products that have ingredients such as benzalkonium chloride and benzethonium chloride, and we have chlorhexidinol, other products that can be used. Because I work for the American Cleaning Institute, I won't specifically state a particular product, which is why I'm giving you the scientific names for these ingredients. But what I can say, if you go to cleaninginstitute.org, and that's my organization's website, they have a wealth of information on how to clean your household, sanitary practices, links to the EPA and the FDA for additional information on ingredients, keeping your family safe, your homes clean. That's a really good resource. And just to piggyback on what Latoya said in regards to different ingredients in hand sanitizer that can be dangerous, you want to look out for the idea that your products may have methanol or 1-propanol. And FDA, they actually have a list on their site. If you Google FDA safe hand sanitizers or something of that sort, you'll see a link that pops up that literally outlines every product that's been identified to have those dangerous components in it. And if you see it, just toss it. Avoid sanitizers that come in packaging that looks like food or candy and things like that, because a lot of children have been ingesting hand sanitizer thinking that they're snacks. Those are things you want to be mindful of when it comes to your home. You just want to make sure that your products are identifying that they're safe for interior surfaces.
And could you repeat that website again? We just got someone who called in.
It's cleaninginstitute.org. It's the American Cleaning Institute.
And Dr. Pope.
Hi, yeah, just to add a little bit to what Dr. Queen just said, about the ingredients. So of course we know they're poisonous, they could be dangerous, keep them out of the reach of children, but have the number to the poison control center handy. That's very important as well. And I also think it's important for individuals to clean the surface. Nothing beats good old soap and water first before putting the disinfectant on it. And a lot of the disinfectants, always read the instructions, that the directions will tell you how much time it should rest on the surface to be effective. It might be 30 seconds, it could be a minute. So that's important. You know, if we want to just spray and wipe and go. And sometimes it requires a little bit more to kill the virus and bacteria.
And Dr. Jones.
Okay, so one of the things that we teach our staff is not the ingredients of the soap, but the soap and water itself. It's friction, lots of running water. It doesn't need to be hot. It shouldn't be too cold. It should be comfortable enough that you can keep your hands under the water for the length of time that you need to wash your hands. It will protect you against COVID. It's also viral season coming up. So flu season, this time of year, we see a lot of stomach bugs going around. So it's that action, that friction, lots of soap and running water and friction to wash away those germs. And then the other thing that I wanted to mention, which Dr. Pope actually touched on, was reading the instructions and knowing how to use it. There was some rumors and some myths going around about disinfectants and whether or not we should ingest them. We should not ever ingest them. I work in pediatrics, so that's something that we educate here a lot. But there was an increase in the number of people that actually had to contact poison control because they were washing their fruits and their vegetables in bleach and then inadvertently ingesting it that way. Please, make sure that we are reading the instructions and we are following them and we are doing what we need to do to keep safe. And if you're not sure, reach out to the local poison control and ask them before you use it. It's better to ask the question than for something terrible to happen.
Thank you. Okay.
Dr. Murdoch, may I also add, there's a website called smartlabel.org. You can actually download an app to your phone and you can look up most of the cleaning products that are on the shelves now, and they'll give you all the information on health, safety, use, and you can quickly figure out if it's safe for you or for what its intended use is.
Okay, thank you. Okay, now, this is another question that's close to me. How do you deal with the stress, anxiety, and uncertainty that this pandemic has brought, especially related to school or work, family life, especially family life, for those who are cared for by a loved one? And I'm going to start with Ms. White.
Okay, so unfortunately, I did have this experience in my household just last week. My oldest son traveled, brought COVID into my home, and gave it to his 11-year-old brother. So I had to separate everyone while working from home, while helping a 7-year-old with ADHD learn online schooling. So my mental health, I had to really, what we call stop and think, right? Stop, take a minute for myself. People say self-care like it's this fancy thing. It is real and we need it. So I do meditation, yoga. I have a gratitude journal that I frequently write in, exercise, good health, eating healthy, and if need be, therapy. Our friends are there to talk to, and that's great, but a lot of times we need a professional to help us. If you do need medication, hey, I'm here for you. Don't worry. There are people who are trained to help you find the right medication that's for you. Because if you don't deal with the stress, then, people have negative coping skills, especially those with a history of anxiety, depression, or substance abuse disorder. So we want to make sure that while we're caring for everyone else, we take time to care for ourselves. Like I said, it was not easy. Luckily, no one here got really ill, but everyone's temperature a couple times a day. I'm cooking 3 meals when my kids are kind of old enough to do it for themselves. So doing that, working, it can be very stressful. So we want to make time for ourselves. And I had to schedule it. I had to schedule time for myself or else it wouldn't get done. I would just work, take care of them, and sleep. So for me, sleep is another big thing. It's very important. You want to make sure you get enough sleep so the next day you're not irritable, you're not grouchy, you have compassion for those when they need it, especially our family. So I would say, a couple ways, like I said, again, the gratitude journal, meditation, yoga, sleep, healthy eating, diet, and exercise.
Yeah, I notice I've been doing more walking. I live near a park, and that really helps me a lot. That really helps me a lot.
Yeah, I've taken to plants and gardening. I went from 0 plants in March to 38. So that's also been very helpful for me. And those who don't have substance abuse disorder, a little wine every now and then can help calm you down.
Okay. What about, let me ask Dr. Pope.
Yes, so of course we know that during the pandemic, we were basically ordered to stay in. If you weren't essential, we were fortunate to have jobs that allow you to work from home. So you can become a little bit isolated. You couldn't visit your loved ones, for example. So using the internet or a platform where you could see them helped. I found connecting virtually with my faith community, my church. We had services online on Zoom that helped a lot as well. And as Ms. White stated, eating balanced meals, making sure you don't develop a drug or alcohol habit if you're home, overindulging in those things can have a negative outcome as well. So staying healthy helps boost your immune system, and maybe, you'll have better outcome if you do come in contact with the virus.
And what about you, Ms. Jones?
So actually, they wrote stress into my job description. So right now, it's a part of my job every day. I have to be available. I have to make sure that I'm, leading the hospital and making sure that we're up to date. Standards have changed repeatedly through the pandemic, so it's a constant on the internet, on computers, on webinars, on meetings, multiple meetings. Today at noon, I was actually attending 2 meetings at the same time. In addition to that, I'm also worried about my family at home. I'm worried about individuals that live in my house that are immune compromised or maybe at higher risk. And so I've got, so I can't ever get away from COVID. It's here, it's at work, it's at home. So I also lead the infection prevention group, and they are in the same capacity. And we want to make sure that they are still able to be leaders too. We actually brought in a mental health professional to talk to us. And one of the things that stood out that he shared was, we are connected up 24/7. It is okay to disconnect. It is overwhelming. It is on every news station. I think even fast food commercials talk about COVID at this point. So it is everywhere. It is okay. Put the phone down, turn the computer off. When you go for a walk, don't constantly check your social media and your telephone. Actually disconnect, because it's not healthy to stay connected all that time. Also, we are separated from our family and our friends. Again, do those virtual meetings. I had a virtual happy hour with my cousins recently, and we had a ball. We weren't able to meet in person, but everybody got their favorite drink, and we sat down and we caught up and we saw each other's faces on the screen. And then the last thing is just kind of check your behaviors. Are you exhibiting some of those negative behaviors? I'm a snacker. And so I really realized that I was, picking up snacks instead of, doing healthy behaviors, which is, like Ms. White said, putting something into your gratitude journal and reminding yourself of those positive things and what you're thankful for, because those are the things that keep us balanced. And please seek professional help when needed.
Okay. And I just wanted to read a comment, Layla Huff saying, wow, Latoya, and thank you for sharing your story. I love the idea of a gratitude journal and scheduling time for yourself. That meant a lot. And did I skip you, Dr. Queen?
You didn't skip me, because now you have me. But I would say I definitely agree with the sentiment that Ms. Jones has, because prior to my current position, I was working with the FDA, and everything shifted gears once COVID started and everything became about COVID. And then I go and find a position in the cleaning products industry where everything's focusing on essentially cleaning COVID. And so it's that issue of needing to check out sometimes because it can become overwhelming. But then something I wanted to add to what was said earlier about just taking a walk outside. I think a lot of people, especially when COVID first started, were super fearful of being outside and out and about. But now as the world has started to open up a bit, I implore people to go outside, get in the sun. You don't have to be in crowded areas. You can go to a park, you can go to a trail for hiking, bring your mask with you. There's plenty of space out there, and even for crowded trails, just make sure you're wearing your mask as you're walking past people. I would say, this pandemic has bred some of the most creative items and activities and adventures that people could have ever done, just because they're forced to, do things that are different because traditional places are not open. So I think that does volumes for your mental health and being able to just maintain your sanity and balance it out. Outside of that, I would just say, given the climate of this world, the fact that we not only had a pandemic, but we also had social injustices that have been plaguing people horribly. It's hard, to stay, to keep your mind in the right place and, maintain your immune balance when everything is stressing you out. So you really just have to give everything its time and consideration and not let anything overwhelm you because it can make you sick.
Okay, thank you. Next question. What do you recommend as we're nearing the holiday season where people are used to traveling, gathering, and eating together? Ms. Jones.
So I think before you travel, you can look to see, are you traveling to an area that's heavily hit with COVID? I think also think about the way that you're traveling. If you can travel by car, that's probably safest as opposed to getting on a bus or a train or an airplane where there are lots of other people and in an enclosed space. Also, maybe even rethink how we're having like Thanksgiving dinner, for example. Instead of large amounts of people, maybe just limit it to the immediate family members that are in your home. You want to minimize your risk to being around lots of people, and that's the perfect opportunity to spread COVID. COVID has been known to be spread when you're shouting, when you're singing, and that's kind of what we do in my house during the holidays. We are talking loud, we are laughing, and that behavior alone can generate lots of those respiratory droplets out into the air. And then if we're in an enclosed space, then those around us can be put at risk. So maybe even doing a virtual dinner for individuals that are higher risk, that are afraid to come out and they're staying at home, maybe prepare them a meal and leave it for them. Think about the senior citizens that are in your family or in your community, because we don't want to leave them out. We, especially during the holiday season, really want to check on one another and make sure that we're okay. And the other thing that takes place during the holiday is a lot of sports, a lot of people going outside. Outside is safest, but when you are shouting, again, when you go to sports events, people are yelling and shouting. Things like restaurants, if you go to a restaurant where people are talking loudly over music, that's another high-risk place. You want to minimize that as well. So think small groups, think kind of a small circle. And if you can, if it's warm enough to do it, have events outdoors where the circulation and the ventilation is much better and it's safer.
Okay, all right. And Dr. Pohl?
I think Ms. Jones pretty much nailed it. She covered it all, but I do agree with just making sure individuals, you still want to connect, because that's what the holiday is about. And we know we have increase in suicide and other mental health issues during those times. And so virtually, if possible, and yeah, that, Ms. Jones said it all.
Okay. Would you like to add anything, Ms. White or Dr. Queen?
I would just say that even when you're amongst your families in your homes, be mindful when you're serving each other food to not talk over the food and think little behaviors like that can easily spread germs. Try to keep your space. you know, when people are bringing food, you know, it's kind of like with a potluck, everyone wants to know who's bringing the food and who made what, you know, you be careful with people that you're eating from. You want to hope that, you know, they're practicing safe behaviors while they're preparing that food.
Okay, thank you. Okay, my next question. As businesses are reopening, can you share any thoughts regarding preventive measures to look for as we visit restaurants, retail stores, personal care businesses such as the hair salon and barbershops? And I'll start with Ms. Jones.
So one of the things that I was thinking about too earlier, and we were just talking about, you know, holidays and Thanksgiving, usually after Thanksgiving, a lot of people rush to the stores to go shopping. Try to do your shopping online if you can. You don't want to be out there with crowds of people. That increases everybody's risk. And then not everybody is compliant with wearing their mask. So I think the misconception is that if I'm wearing a mask, I'm protected, and that's not true. The mask, the person that's wearing the mask is the one that's protecting those that are around the other person. So if I'm wearing a mask and you're wearing a mask, we are protecting each other. But there are a lot of people in the community that we're seeing their mask is below their nose, below their chin, above their forehead. They are not protecting. So if they sneeze, if they cough, then those respiratory droplets can be generated in the air. So I guess when you're visiting retail centers and stores and salons and things like that, you want to make sure that they are enforcing mask wearing. Are they requiring people that are coming into the store to wear their mask, and are they requiring them to wear it properly? If you are going to a barbershop or a hair salon, are they wiping things down? Are they disinfecting their equipment? Are they disinfecting and cleaning things that are used on multiple people? And are they wiping down the chairs? Every time someone gets up. So those are some of the things that you want to look for. You want to make sure that they're cleaning surfaces and that they're enforcing the mask rule. And then if you want to go further into it, you could even call and ask them, do you have sick policies? Do your employees, are they being screened? You're at the hospital every day. Everyone entering the building is being screened for symptoms every time they come to work. And we are enforcing that 100%. And I know a lot of other businesses and places are doing that as well. So those are some things you can look at.
Okay, and Dr. Queen?
I would take it further to say that, say for example, I've been to restaurants to pick up food to go, but you know, now some restaurants are having socially distanced dining inside. I say pay attention to how that dining is set up, because generally, you know, the tables and seating should be 6 feet apart. But I've been to restaurants where, like, for example, people were sitting at the bar and the seats weren't 6 feet apart. I would say maybe a good 3 feet apart in between the seats. And I know restaurants, you know, are trying to, you know, recuperate funds, but it's not really following those guidelines. So you have to think that if those type of practices are happening, what else are they being relaxed about when it comes to their policies in terms of COVID and disease prevention? Outside of that, I think Ms. Jones covered a lot of information.
Right, and Dr. Pope?
Sure, yeah. So just to add to what the other ladies said, so places like the nail salon, for example, you know, you want, if you're someone that gets the nails done, you want to make sure that they're using those barriers, those physical barriers, so sneeze guards, and also to see if they're cleaning, like Ms. Jones said, the barbershop, you know, are they cleaning between clients? You know, do they check your temperature when you come in, how you pay? I know I'm not really a nail person, but I go once in a while, and the gentleman there uses like a touchless, you know, the Venmo, you can just send it that way, or I guess they do like Cash App, you know, things that they didn't do before. They're not really handling cash, you know, trying not to touch, you know, in that aspect, and they're wearing gloves as well. Preparing your own meals isn't a bad thing. You don't have to, you know, go out and get the food. Maybe it's time to bond with the family a little bit and cook the food at home. You can also pre-order. For example, Sam's Club. I'm not trying to promote any businesses, but some businesses, they sell groceries. You can have it delivered to your homes. You don't have to go out there. So I encourage people to take advantage of those things.
And Ms. White? Anything else?
Well, just like Ms. Jones was saying, you want to make sure if you do go out, you want to do the outdoor seating. see how the staff is wearing their mask, if they're wearing their mask, if they're really mandating people who come in to wear a mask, things of that nature. You want to make sure if you can open the door, open it with your elbow. Always take your hand sanitizer. I know soap and water is best, but some people don't want to go into the restrooms, which I completely understand because they're not checking every 5 minutes to clean those. So, and like Dr. Pope was saying, you can eat at home, have your meals delivered, cook, make it a family affair.
Okay. Now this is the opportunity for our panel to share key takeaways for the audience. Words of wisdom.
Hand washing is key. Wash your hands with soap and water. Maintain your 6 feet or more. Exercise. Take the preventative vaccines. Highly recommended. I know people don't. A lot of people think you get sick by taking the flu shot. You really don't get sick from taking the flu shot. It's not live. You're not actually getting like a live vaccine. I'll leave the rest to the rest of the panels, but that's what I have.
I want to piggyback on the flu shot, because that's one of the biggest questions. So in addition to my infection prevention duties here at work, I'm also the flu shot nurse, and I'm responsible for making sure 700 employees and volunteers are all vaccinated for the flu. The most common question I get is, can you get sick from a flu shot? And the answer is no, you cannot get sick from a flu shot. It is not a live virus. The benefit of the flu shot is that it will protect you from the flu, which is also deadly. It will also prevent flu outbreaks during a pandemic. And I don't want to know what a flu pandemic in the midst of a COVID pandemic would even look like. And so we are recommending that anyone over 6 months get a flu shot. And the importance of that is to protect ourselves, protect others, and reduce the burden on the emergency departments and the healthcare system right now. A lot of hospitals are really struggling to keep up with COVID patients, and we want to make sure that they can get treated. And if we are reducing the risk of flu, then we can prevent a lot of those things from happening. So we want to make sure. Hand washing, I say it all day, all the time. Hand washing saves lives. Hand washing, hand washing, hand washing. Don't underestimate hand washing. I actually have hand sanitizer clipped to my purse. So when I'm going in and out of stores, if I don't have a sleeve or something to pull open those doors, when you're washing your hands, use a paper towel to turn that faucet off so you're not reintroducing those germs, and protect your T-zone, your eyes, your nose, and your mouth. So clean your hands before touching your face and after touching your face, before touching your mask, after touching your mask. You want to make sure that you are cleaning your hands. If you think you've cleaned them enough, you probably haven't. Clean them again.
And Dr. Queen?
Yes, and I just want to add one tidbit about the vaccines. I know sometimes in the community there's a lot of distrust about vaccinations and potential dangers they may pose just because of things that have happened in the past. And I would say the number one thing you want to consider is benefits versus risks. And you want to have conversations with your health practitioners and your doctors and ask them the hard questions that maybe your family and friends can't answer, because your family and friends, unless they're a scientist, unless they're well-versed in their research, like published research, not random science news sites, you shouldn't take their advice on whether a vaccine or any type of drug is safe or not safe for you. Keep that in mind as you move forward. And I want to put something else out there, that having a negative COVID test is not a badge of freedom. You literally can be negative today, walk outside tomorrow, hug your best friend, and be positive that same evening. So just because your test is negative does not mean that you can be lax on your behaviors, not wear your mask, go out and party somewhere. It doesn't work that way. So it just lets you know that at this point in time, you were negative for COVID, and that should make you feel good. But it doesn't mean that should absolve you from doing your best to try to keep yourself and others safe from contracting the disease.
Okay, and I've got a couple of questions. Someone asked, how can someone find a suitable therapist?
So you can find a super therapist honestly by looking at the back of your insurance card. It should be a number on there where they can help you find a therapist, one that's close to you, one that specializes, let's say, in trauma, PTSD, eating disorders. So you can always go through that. You could ask your medical provider, your PCP, for referrals. You could even ask honestly someone who sees a therapist, what do they like about this therapist? Is this place clean? Is it reputable? And you may not always find that therapist that fits you the first try. So just remember, it's a relationship. So don't get discouraged if that relationship with the first therapist doesn't quite work out. But there's always ways you can find a good therapist. You can even go on, I think it's Psychiatry Today. They have therapists. It's online. They have therapists in your area. You can put in your zip code. Again, you can put in what you feel you need treatment for: depression, anxiety, PTSD, or others.
And then I have another question. It says, I understand vitamin D is important. How do we know if we need it?
I say start with a visit, to your healthcare provider. And that's one of the things that I know almost every patient, if I have 10, 7 will need vitamin D replacement. Especially people of color, we need a little bit more time in the sun to have the absorption. And I know a lot of us now have been inside because of the pandemic and we're not going outside. And so replacement is important. So I would start with baseline labs with your healthcare provider.
Then someone asked, what advice can you provide in reference to working out in gyms or fitness centers?
Go ahead.
I say just make sure, even though most gyms require that you clean up after you're finished, just clean up before you use the equipment anyway. Just assume that the person in front of you never sanitized the equipment. Try to keep your space. Most gyms I'm aware of, they have signs that kind of space out the treadmills and other types of equipment so that you're not completely up on people, but you have to remember that people are like breathing really hard while they're running on those treadmills and other devices. So they have on masks, but you have to consider the fact that these masks have sides. They may be open. They may not have an N95 mask on that's blocking out the particles. So you want to try your best to just space yourself out as much as possible, even if it's more than 6 feet, and just be patient, wait for the equipment to be available. And that's what I offer.
Okay, I got another question. What is the best way to build up our immune systems with food and vitamins?
Okay, I'll start with that. Okay, so that's the number one way to boost your immune system is through a healthy diet and exercise. I would say a very rich plant-based diet to start is probably the healthiest way to make sure your immune system is boosted. I would say that make sure you're getting lots of dark leafy greens, and so you can get your antioxidants. There's tons of websites that you can Google for foods that are rich in vitamins and antioxidants and foods that boost your immunity. There's tons of information out there, and just find a diet that fits for you so you can actually stick to it.
Okay. Then my next question, why are COVID cases surging?
So I can try to take a stab at that one. So I think a lot of cases are surging because people have started to let their guard down. I think people are tired. We talk about something here at the hospital called mask fatigue. People are tired of wearing it. It's uncomfortable. Also, as businesses and places of worship and public spaces are starting to reopen, people equate that with it's safe to go out, it's safe to be around others. I also think that it's surging because it's now getting colder in many, many states across the US, and people are now congregating indoors, whereas before they were able to spread out outside. And then the other thing is there is what we call asymptomatic spread. So I can sit here today and feel completely healthy and take my mask off around my coworkers, but still have COVID. And just because I don't have symptoms doesn't mean that I can't spread it to other people. So that's why it's important to wear your mask and make sure that those that are around you wear their mask also, so that we're containing those droplets. But really, I think that because people don't have symptoms, and also because the list of symptoms is so widespread, a lot of people were attributing some of the respiratory symptoms to maybe seasonal allergies, and they didn't think that they had COVID. A lot of people went and got tested and were shocked that they did have it, but it was too late at that point. They had already been around others and had spread it. So we cannot let our guard down. We have to be vigilant. We really have to be vigilant.
I think you just answered this last question. It says, is it okay to take your mask off if you're out, but not within 6 feet of others? I think he answered that.
If you're outside and you're alone, I was actually walking outside today, and I saw someone maybe about 20 feet away, and she saw me 20 feet away and she put her mask on. And I said, you're 20 feet away, we're outside, you are okay not to put it on. Now, if we're at the same table or we are within 6 feet, yes, you should put it on. In indoor spaces, it should remain on at all times. But if you are alone, you can take your mask off. I've had a lot of people say that. I've seen a lot of people wear masks in their cars and they're alone. I'm not exactly sure why, but if you are by yourself, you're not around someone else's respiratory droplets, then you don't need to put the mask on. But just kind of be mindful about where you are and who you're around. So one of the biggest ways that it's being spread within hospitals right now is not from the patient to the healthcare worker. It's when the healthcare workers go into the break room and they take their masks off to eat. We are wearing full protective equipment when we're caring for patients, but we seem to let our guard down in those little scenarios. So just kind of keep in mind, who are you eating with? How close are you? Are you in a small break room? Can you eat lunch in that space by yourself? Maybe take turns eating lunch. So we want to make sure that we're just kind of mindful of where we are when we're taking those masks off.
Okay, and one comment that just popped up, this was super helpful. Thank you so much. Okay, well, I think time permit, we did well. And I just want to say thank you. This concludes our program for today. Once again, I want to thank Ms. Jones, Dr. Pope, Dr. Queen, and Ms. White for joining us today. I would also like to acknowledge the Coppin community, faculty, staff, students, alumni, and members of the community for joining this discussion. Let's use the information we learned today to take better care of ourselves and each other. Finally, I would like to take a moment to recognize and thank the Office of Alumni Engagement for hosting this event. Thanks again, and have a great and safe evening. Comments are coming in. Ladies, great job. This was amazing. Thank you, everyone. Thanks so much for all your super helpful tips again. So we done good, as they say.
Stay safe, everyone.
You too.
Thank you, Dr. Murdoch, and stay safe, whole panel. Have a great afternoon.
Thank you.
Yeah.
Be safe.